Pelvic organ prolapse happens when one of these three pelvic organs collapses into the vaginal wall from front, top, or from the back. So bladder in the front, rectum in the back, and uterus from the top. The symptoms of pelvic organ prolapse are feeling of heaviness in your lower abdomen or in your genital area, feeling of pressure. When you sit down, it feels like you're sitting on a ball. You can have urinary incontinence, you can have fecal incontinence, you can have pain in your vaginal area, feeling or seeing a bulge or lump coming out of your vagina, painful intercourse. Pelvic organ prolapse is very common. About 50% of women over 50 have some form of this disorder. Some women end up having symptoms from prolapse, and there are some people who have prolapse but no symptoms. So how pelvic organ prolapse happens is when a person is bearing down, whether it's during vaginal birth, whether it's lifting heavy weights, or you are just holding your breath and bearing down. Also with time, gravity acts on our organs, pulling everything down, and all that bearing down or pushing down causes the pelvic organs push down into the vaginal canal. So has like some weak areas, and then all that pressure like from this ball pushes the organs into the vaginal wall. And it kind of collapses down into, pushes onto the vaginal wall. If you have symptoms of pelvic organ prolapse, you should talk to your doctor. You can see your midwife, your gynecologist, your pelvic floor physical therapist to get an exam. A physical therapist assesses your pelvic floor muscles, your pelvic floor organs, all three of them, and your gynecologist and midwife can do that as well. So they can assess not only the pelvic floor muscles and organs, pelvic organs, they will also assess your hip, your back, your knees, your feet, because they can be interrelated and affect each other. Now, once you are diagnosed with pelvic organ prolapse, now your physical therapist can work as a team member with your gynecologist, your midwife, your other providers to help you manage the symptoms of your pelvic organ prolapse. After assessing your pelvic floor muscles, we'll see if you have any trigger points, any tightness in your pelvic floor muscles, and they'll also assess the strength in your muscles, and they will assess your pressure management. Are you able to relax your pelvic floor muscles? Are you able to contract your pelvic floor muscles? According to that, they will come up with the plan, treatment plan, and work with you. So they can work manually to help you release the muscles. They can teach you as well how to do it, self-release. They may give you some strengthening exercises depending on the assessment. It all depends on what they find during their initial evaluation and assessment. So that first assessment is very important. Your physical therapist will also work on teaching you proper breathing techniques, coordination of your pelvic floor muscles and your other muscles. Your physical therapist may also work with your posture alignment to teach you proper posture to prevent pelvic organ prolapse, the symptoms of it, to manage the symptoms of pelvic organ prolapse. Your provider may also discuss constipation with you, because preventing constipation is really important if someone is suffering from pelvic organ prolapse, because every time you're bearing down, you're pushing down, you are putting pressure and causing those symptoms worse. So it's really important to manage constipation. So your therapist may talk to you about constipation, management of constipation. Depending on the grade of your pelvic organ prolapse, your Therapists may also discuss use of pessary for you, depending on your needs and your symptoms and your lifestyle. Your therapist or your gynecologist may discuss pessary for you as well. Pessary is basically a support that goes through the vaginal canal to support your pelvic organs. It really depends on your symptoms, your lifestyle, your needs, your provider, your gynecologist, your midwife, or your physical therapist may discuss all these options with you. The ultimate goal of physical therapy is to help you resume your functional activities, your sport, whether it's lifting, running, jumping, or playing with your kids, without aggravating your symptoms.